Liposculpture Talk, Episode 4. Arm jingle, arm flab, arm bags, bat wings, and my favorite, bingo wings. All kinds of funny names we use for flabby arms. This is a big topic for women, but many women don't find it that funny. Women with disproportionately large or saggy arms can be very bothered by them, and it's impossible to get through a summer without showing your arms off. No doubt, though, that attractive arms are in. Jennifer Aniston, Cameron Diaz, Madonna, Michelle Obama, all making it trendy to have sculpted arms. I'm Chris, the host of Liposculpture Talk. Today, we're talking about arms, whether you're going for perfectly sculpted arms or you just want to trim down the size of those arm bags.
You know, up till recently, there hasn't been a lot of good options for women in terms of either just having big arms or saggy arms.
That's Dr. Mir Jaffrey from the Lift Body Center in Chicago and Schaumburg, Illinois, online at chicagoliposuction.com. He trains surgeons throughout the country on the use of lasers for liposuction. Today, Dr. Jaffrey is going to talk about options for treating those flabby arms. And he's going to give solid advice for anyone going into a consultation for your arms. He's going to give you some good questions to ask and things to think about. If you're considering trimming down your arms, you can't miss this. Dr. Jaffrey says, in terms of women who have just a little extra fat under the arms, traditional liposuction actually has not been a good option because
a lot of times what happens in those situations is the fat is removed and then you've got essentially an empty bag, like an empty bag look to that skin. So obviously that's not terribly attractive, and it's not something that most women want. They want to have the skin sort of contract along with that removal of fat.
In the past, the only option for women with saggy arms and loose skin has been brachioplasty.
Now, brachioplasty is otherwise known as an arm lift. And an arm lift is a great option if you don't ever want to show your arms to anybody. If you just want to look good with clothes on, then yeah, an arm lift is a very good option. You'll get a nice tight result, but it leaves a very, very ugly scar, in my opinion. It sort of like zips up all the way up the arm. So, that's not an option that most women want, and frankly, it's not an option that I think we as doctors should try to offer people unless it's absolutely positively required for a result that's desired.
So, Dr. Jaffrey says there's one technological development in recent years that's changed liposuction, especially for the arms, and that's
laser-assisted liposuction, or laser lipo. Has really revolutionized all types of these procedures involving the arms because it's good for both fat and skin. Now, I want to emphasize the idea of those who know how to use lasers, because I always hear about patients who come in and they've seen some other doctor and who's told them, there's nothing that they can do for their skin. Even doctors who have lasers. Just because you have a laser and you use a laser in your practice doesn't mean you know how to use it well. The reality is it's like any tool. A tool in the hands of a fool is still that person who's using it still a fool, right? So I'm not saying that some of these doctors are fools, but the point is that you got to know how to use your instruments. Otherwise, there's no point in having them. And I've found the majority of people that I have seen use lasers are not using them properly. They're not using them aggressively enough.
Dr. Jaffrey trains doctors on laser liposuction throughout the country, and he says that they're always amazed at how much more aggressively they need to be with the laser than they thought in order to get a result. So if you hear people say that lasers don't make that big of a difference, he says,
it does. I can tell you, having done thousands and thousands of liposuction cases, If you need to tighten skin, and in the arms it's critically important to do so, the laser does make a big difference. It's a no-brainer for a woman, a younger woman with extra fat on their arms to use laser-assisted liposuction.
So for a woman that might be a little bit older and they may have lost some skin elasticity, do you still think that laser liposuction is still the best option?
It sort of depends. You have to really talk about it with an individual client and figure out what their goals are. And the vast majority of time, the women I speak to who have, sort of more skin sagging arms, say they'll be satisfied if they can just get some reduction in the amount of skin that they have and the size of their arms.
So when patients don't have to have perfectly tight sculpted arms, what do you recommend then?
In those cases, we will definitely recommend doing a laser-assisted liposuction procedure, even if it's primarily to treat the skin. It is very rare that we'll ever talk about a brachioplasty, except for in extremely severe situations or if somebody has an unrealistic expectation of the amount of skin reduction we can get. But you can get a lot of reduction in skin. There is no question about it.
Arms can be a rewarding procedure. You just have to make sure you're going to an office where they do a lot of laser liposuction of the arms. During a consultation, make sure they have lots of photos. Photos are critically important. Not just photos from a brochure, but real photographs of procedures that doctors performed. Disproportional arms. Arms sagging with skin. They don't have to ruin your summer. There's lots of ways to improve them using technology.
Some of the things that we do are beyond laser liposuction. Some of the things we'll do is from the outside. If the skin is sagging pretty badly, we might treat it with laser lipo from the inside, and then come on the outside and laser the skin from the outside to get extra contraction. There's all sorts of things you can do to really try to make your arms look as nice as possible. And you don't always have to have a brachioplasty. And I think that most people who go in for consultations for brachioplasty don't really know what all their options are. So find someone who knows how to use a laser. Somebody who does a lot of it. Certainly, owning a laser doesn't count. Just because you own a Smart Lipo or a Cool Lipo or Pro Lipo or whatever doesn't mean that you're going to get the optimum result. That's where the surgeon does make a difference.
At Chicago Liposuction, with all the doctors, they have a very standardized protocol when dealing with arms. They've learned what works. Everybody's using the same procedures, so they get a very consistent result across the board, whether your procedure is performed by Dr. Joffrey, Dr. Parisi, or Dr. Smith.
Actually, it's interesting. Dr. Smith has been around for a long time, and he was a main plastic surgeon at Evanston Hospital, Evanston Northwestern, for many, many years, and trained many of the surgeons in the area. He was actually a professor of plastic surgery even when I was a medical student at Northwestern. Dr. Smith is actually one of the physicians that when he first joined me didn't really have an idea so much about how these lasers could make a huge difference. He is a very, very skilled surgeon. He's an excellent surgeon, but he hadn't had the exposure to some of the technology parts of what we have to offer, and he was absolutely amazed at what we could do with the laser on the arms. And he has not done a brachioplasty procedure since joining us, which is saying a lot. This really does make a difference, so choose, and you should definitely do your homework.
So, Dr. Joffrey, if any of our listeners have questions for you, or if they want to schedule a consultation in your office in Chicago or in Schaumburg, so they can get a hold of you at, through chicagoliposuction.com, your website. Is there any other way?
You can also you can also give us a call at 847-995-9000 at Lift Body Center. That's the name of the business, and that's our office. And so consultations are available in both Chicago and Schaumburg. In Chicago, we have a small consultation office. We have a great big office in Schaumburg where we do our procedures, and it's really nice out here. So we also do consultations on the phone for people out of town and even out of country. So we'd love to hear from you.
You have reached the offices of Doctors Joffrey and Parisi. To schedule an appointment, or if you're an existing patient, please press 1.